Good morning, welcome, and thank you for tuning into Health Talk. I'm Dr. Victor Politi, the President and CEO of New Health. So as healthcare in America is changing, New Health is part of that change. This half-hour program will provide you with some essential information about our services and facilities that provide top-quality care that fits into your lifestyle. New Health roots go deep into Long Island's history. What began in 1935 as a 200-bed general hospital has now become part of a unique health organization with multiple centers of care and a commitment to deliver excellent essential care to everyone at every stage of life. You already know us as Nassau County's premier Level 1 trauma center, but we have so much more to offer to the community, including a full-service, state-of-the-art Center for Care in Nassau University Medical Center, an A. Holly Patterson Extended Care Facility in Uniondale, and the New Health Family Health Centers located throughout Long Island. Our improvements are making us a leading provider of primary and tertiary care services that rival the best in the country. So I'd like to welcome you and thank you for tuning in this morning to us. And we're going to talk a little bit about Nassau University Medical Center and about some of the programs that we have. One program in particular, that's called LEAN, L-E-A-N. That LEAN program, and I'll have Mrs. Zink talk about us and explain it to us a little better. But this is a program that we incorporated several years ago into the hospital to look at our processes, to see what we develop and how different organisms and departments in the hospital operate, and basically streamline them so they could work better. There are other programs like that, like Six Sigma out there, but we've chosen the LEAN methodology. And I think what we'll do is start off by introducing Mrs. Zink. And Janeann, why don't you tell us about yourself and how you became involved in this LEAN process?
Good morning. I started at New Health 7 years ago. And 5 years into my employment there, this opportunity was presented to me about becoming a facilitator for this program called LEAN, brand new to the hospital. And I was offered the opportunity and decided to take it because I believe that changing the processes that we use to take care of our patients is quite important, and that LEAN is a vehicle to achieve that. Even though if you were to Google LEAN right now, you'd see that it's predominantly used in manufacturing. As a matter of fact, it started post-World War II with Toyota to enhance their production lines. So one would say, what does a production line have to do with the way we take care of patients? There are absolutely elements in the workflow that we bring forward by using LEAN methodologies to eliminate waste, which is the number one big interference with our ability to promptly and adequately take care of our patients. So at the bedside, the processes that we change have to do with workflow and what we do first in the process to take care of a patient and how we can expedite that flow so that our patients get what they need when they need it in an efficient and prompt manner. So that really excited me, to have that opportunity to be able to be part of changing the way we take care of our patients. So in 2013, when the program started, I was one of two facilitators, and now the team is 3 facilitators and myself. So.
And it's true, we're a hospital, and everything about us is the patient. We come to work, the hospital itself, the programs, everything is about the patient. And because they come to us for help, they're sick, they're injured, and we have to do everything we can to get them better and get them discharged from that hospital. So anything that we can do, or that you could help us in making that process streamlined, more efficient, and make a better patient experience, that helps us. So it really is important to me personally and to the hospital that you become involved in all the different aspects of the hospital. Now, you're also a nurse, so why don't you tell us about yourself before you went into this LEAN? What did you do?
I started my nursing career as a bedside nurse in med-surg, and that's always been where my expertise has been. Moved into nursing education, other leadership roles, always focused on med-surg, taking care of the patient. Mm-hmm. And that's been since 1979. So
okay,
you
so
roll your
years,
eyes.
yeah.
That's
no,
a,
well, listen, I've started around that time myself.
Yes, so I was had the opportunity to be a chief nursing officer at two facilities, and that's given me a very broad perspective and overview on not just nursing, but other dimensions in the hospital, how those pieces come together.
So you put together your nursing experience together with this processes improvement program called Lean, and you're able to bring bedside knowledge, clinical knowledge, right to the table. And I know personally I've been involved with different Lean RIEs, which are, what does that stand for?
Rapid improvement events.
Okay, I don't want to screw it up. So rapid improvement events. So I've been involved in these myself, and I've watched firsthand how you can actually look at a process, incorporate the actual people that do the work. If it's in the central sterile area or in registration, you actually have those are the people that actually are in your group, and they actually look at the process that they're currently doing, and then come up with ways to make it better.
Absolutely.
So it's actually their idea. It's actually the workers coming up with ways to improve the work.
That's the pillar of lean, that the solutions come from the staff and not a person like yourself, or the director of nursing or the director of the department. So we have a very defined recipe for selecting the participants, and we go by the concept of supplier to that process and customer to that process. Sometimes that word customer, when you're in healthcare, makes folks feel uncomfortable, but an example of a customer might be another department, a physician, and absolutely our patients. We've not yet incorporated a specific patient in any of our events, but that would be something that we would aspire to bring a patient to the table to also help us formulate solutions to waste that we see in the process of care. But that's not the only place that we focus in lean. We have focused in registration, in what one would call revenue cycle, where we look at how expeditiously we registered, are we getting proper information, because of course at the end of the day we need to be sure that we can continue to support the hospital and therefore the patients. So without a revenue cycle that flows seamlessly, that would interfere with our ability again to keep the patient in the center of what we're doing. So it's a learning process not only for the team, but for the staff in the hospital. Many times you'll hear that lean is a method of culture change, and that word, culture change, tends to be overused, in my estimate, that it becomes the excuse for everything that doesn't work properly. When in fact what we're trying to do in lean is not only change processes by eliminating waste and by, as you said, Dr. Politi, allowing the staff to demonstrate the solutions and come up with those ideas, we're also trying to change the way we all think about the way we do work. And so when you use an organized methodology, which that's what lean is, where you look at the process steps and you hear them from the staff that does the work, not the supervisor, the staff that does the work, you begin to see the workarounds that staff undertake to accomplish what they believe their supervisor wants them to accomplish. And when we go in with lean, having been armed with this information that we research for several weeks before the event, we bring that data to the table. We bring data about time observations to the table. We bring data about revenue cycle, about the time it takes to see a patient enter the emergency room and be seen by a doctor, and then ultimately, if he decides to admit, bring them to the floor. We use data to make our decisions, and not the squeakiest wheel. So we've actually, with these processes, have changed flow time in the emergency room. We've moved fast track from the main emergency room to out front and center. So if a patient needs fast track care, they're not going into our emergency room. They're going into the area and adjacent to the emergency room.
So it's like urgent care. So you've incorporated in the emergency department itself an urgent care center. Because you see all throughout Long Island,
Yes.
they're opening up these urgent care centers where people can come in with a sore throat, an earache, or some minor cuts, and they could see a physician and in and out, relatively rapidly. So what you did in Nassau University Medical Center is establish an urgent care right there in the emergency room, so that if someone comes in with an earache, a sore throat, we have physicians and PAs and nurse practitioners that'll see that person immediately or very rapidly.
Yes.
As a matter of fact, how fast do people get seen?
I don't want to quote a time, but we do have that published in our on our website through all of the metrics that the hospital is required to post.
I mean, will someone be seen, within 10 minutes or so of walking in the door? If someone comes into the hospital.
Well, as you know, a patient is seen immediately when they come into our waiting room by a nurse. So you can't get any prompter than that. A nurse is evaluating, or what we call doing a rapid triage on that patient the minute they walk in the room. And based on that assessment, we determine where the patient should be queued. So it's not first come, first serve. It's most critical, the sickest patient, if you will, by the nurse's triage assessment.
So pediatrics, we have our own separate pediatric department?
There's a separate pediatric area, which actually was facilitated by our moving fast track from the main emergency room out to where it is now. Because prior to that, it was adjacent to the pediatric area, which was not a comfortable environment for the children and their parents.
So they basically, kids can come in and be seen by a board-certified pediatrician?
Yes. Yes. So we've done other work in the emergency room, for instance, in the main body of the emergency room, to how quickly we're able to get the next patient in, or room turnover. And something as simple as changing how the beds are cleaned, who strips the beds, who makes the beds, was a game changer in how quickly we can get our patients into the emergency room. So again, all of this information is reported nationally and
So
compared.
actually, the patient benefits.
That's the whole focus. What can we do better to focus on that patient and make their experience wonderful?
So you look at all areas of the hospital. This was the emergency room,
Right.
and you figured out, okay, the way the patient presents, to get the patient in fast, to get the person registered fast, get to see the doctor quick, and be discharged if that's the case. We established the physical area of the hospital, the way supplies are handled, the way everything is being done. So you look at a whole area. So what other RAEs have you worked on at the hospital?
We have done rapid improvement events in ambulatory care. And in that venue, we talk about how quickly the patients are seen, again, how they're queued. The first event ever at Nassau University was around the pediatric registration process, where we identified that a patient, in this case a child, doesn't come in obviously by themselves. It's with mom, dad, grandparents. And so we would walk into a throng of patients and their families waiting to register. And then that group was sent to register and then sent to wait for the doctor. And then they were called from the waiting room to be examined first by the nurse, and then she would send them back to the waiting room, and then the doctor would call them later.
So a lot of useless steps.
Right.
Yeah.
And who was in the middle of all these useless steps was our little patient and their families. So the first lean RIE was actually to register the patient and move them directly into an exam room and have that physician, that nurse, that medical assistant go to the patient and not have the patient go to them. So that really changed the whole ambiance of our pediatric waiting room. Less crowded. The patients are seen, register, and get into a room in a much more comfortable venue than being gathered in one place and
So
waiting.
now we're opening up a brand new primary care center on the first floor at Nassau University Medical Center, and it's about $24 million primary care center. And pediatrics is going to have about a third of that area, and they're building a beautiful waiting area for for the children. There's actually another separate area for children that are actually sick, so some kids sneezing and coughing.
Mhm.
You know, we don't want to put them with someone who's coming for vaccines, so we have them separate in a separate waiting area. Beautifully appointed, brand new examining rooms. So, are you involved in the flow through that area as well?
I will be involved. Our team has been invited by yourself and those that are creating the area to incorporate our lean principles in queuing the patients, visual management, which is uh, a wonderful tool that we use in lean, so that instead of folks needing to go room to room to see if they're vacant, for instance, that one could look down a hallway and see a flagging system that says, okay, this is a green room, which means ready to go for the next patient, or yellow, I'm waiting for you, doctor, or red, meaning nobody has seen this patient yet, medical assistant or nurse, you can get in there. So we use visual management as a way to improve flow and to make it easier for our staff as well. Because certainly if you're saving steps in your daily work routine, uh, that's wonderful. Our most recent event that we just concluded this week in the operating room reduced the distance that the circulating nurse walks when she's preparing for the next case from 3 football fields worth of distance to 1. So when you measure it in that concept, especially if you're a football fan, you understand that there is and will continue to be a lot of waste out there that we need to go after. So if the nurse is walking that distance, that's time she's not spending with the patient.
And I know you also moved the ambulatory surgical unit. At one time, it was in an old area of the hospital, and you moved it right into the area right by the operating room, where if patients are coming in for ambulatory surgery, they don't have to go to 2 different areas in the hospital. They go to one area, and believe it or not, it's taken care of, moved to the OR, and then the post anesthesia unit, the recovery room, is right adjacent to it. So you put everything in a small, and in the same vicinity.
Absolutely. And that in lean terms is called one-piece flow or flow cell. I start the work, I get it perfect, and I move the patient onto the next dimension. So that's something that, again, the staff came up with. Staff like the surgeons that take care of our patients, the nurses that take care of our patients. In a non-lean methodology, the CEO might say, move ASU. And everybody would move it, but not incorporate. So now what do? How do we organize the work that we do to accommodate this new location and this flow that we're going after to make the experience positive for the patient?
So these are patients that come in for maybe some ophthalmology surgery. We have an unbelievable ophthalmology team at Nassau University Medical Center under Dr. Marcos and her team. She's really an amazing ophthalmologist, all sorts of eye surgery, or we'll have some other ambulatory surgery, podiatry. We have in the hospital as well. Orthopedics, they do a lot of one-day procedures in that operating room. So you park your car, you walk into the hospital, you go up to the 2nd floor, and everything is right there for you. You don't have to be running all over the hospital and going to 15 different places. And when you're ready, your family's in the waiting room right outside the door you walked into. So it's not all, doesn't inconvenience the family. As a matter of fact, the old ambulatory surgical unit now, I understand you're repurposing that area.
We absolutely did. And again, that was something that came from the staff. One of the initiatives that Lean is undertaking is patient satisfaction. And at the heart of that are the staff members that take care of the patients and the families. And they identified that a gap in the way they're able to address patient and family needs is a comfortable waiting room. And that area was identified with your help and retooled and repurposed so that now families have a proper place to wait, particularly in critical care where you may be having patients that have been in a trauma event, a cardiac event, or a medical issue, that you're obviously concerned about as a family member. You don't want to leave, you want to be there, and we have been able now to provide a nice area for that.
Yep, yeah, I've seen it myself. It's a nice big area. It'll have, when it's finished, consultation room, so the surgeon can take the family into a quiet, private room to talk to them about the care that your family member has got, given. It's going to have some TVs, a little kitchenette area, so that if families want to stay, if there's a horrible car accident or a trauma, or even the cardiac care unit, those families have a nice place where they could actually spend, some time and have some coffee and drinks and stuff and relax and wait to hear the good news about their family member.
I think the most impressive element of lean is that it comes from the staff, and involving the staff in decisions where in the old model of leadership was really not considered. It was a top-down methodology where the boss would say, this is what we're going to do. And so now we've asked the staff, we've said, here's our reason for action, here's what we're trying to change.
Right.
How would you do that? And they come up with great solutions.
Yeah, I mean, these are the people that are doing the work every day.
Right.
Yeah. And they see, transporting people and moving things around in uncomfortable, environments that people might have to be to because they're sick. And you don't want to be moving them around when they're sick. You want them to be in their warm, their clean, comfortable room in the hospital, and just go, if they have to go for surgery, right to the OR. So I think a lot of these processes that you're looking into really do help the patient. And like I said, that's what we're about. I mean, everything with me in that hospital is about the patient. So when we discuss anything, whether it's finances or emergency department or treatment, it's all got to be relative to improve patient care and patient satisfaction. We want our patients to leave that hospital and have a great experience, because truthfully, we're one of many good hospitals in Nassau County. We're blessed here in Nassau by having some really great healthcare systems, and there's a lot of competition. And we're right here in East Meadow. We're surrounded by some great areas, and we want people in our communities to feel very, very comfortable coming to my hospital. They love the emergency room. The ER is amazing. It's the level 1 trauma center. The helicopters are landing there. The ambulances are there. I mean, it's the place to go, God forbid, for a heart attack or a stroke or car accidents. That's where the fire departments and the ambulances are going to take you, because they know you're going to have a board-certified ER guy, brand new $38 million ER that's probably state-of-the-art. I mean, it's really people from all different hospitals, when they're designing their emergency rooms, come to us to see how we did it. Great operating rooms, great trauma surgeons, great orthopedic surgeons, plastic surgeons on staff that are there to take care of you. So, I mean, the Nassau University Medical Center really is the place to go. And so now we need to take it to the next level. I need to make sure that my inpatients, now they get up to the 7th floor, the 9th floor, the 11th floor. We have great nursing staff. I really do. Amazing nurses, amazing. The hospital, honestly, is probably the cleanest hospital I've ever seen. I mean, I welcome anyone just to come into that hospital and to look at how clean this hospital is. You could comb your hair on the floor. It's that shiny. And that's how the pride that the housekeeping department has in that hospital. The food is excellent. So all these things that make for the stay, including the physicians and the care, are excellent. And I want that word to get out to the community. And so by you putting these processes in place and making that patient experience even better, it can only help, increase what people say about how good their experience was at Nassau University Medical Center. And that's really, I want that care to be nothing but the best and to be very competitive with the other hospitals in Nassau County. And let me tell you, we're really doing it. We are really making a dent, and we're seeing a lot more patients, and we're seeing a lot of critically ill patients and having some really great results with those patients. So, thanks for all you're doing. I mean, so what's the next step? Where do we go from here?
Where we go from here is working on having all of our executive staff and leadership talk about lean and do what you do, and that's go to the Gemba. The Japanese word where lean was born, about going to see where the work is done. I've seen you and I've been with you when you walk around and you're looking at things. That's the best way to understand what's happening with the work. Not at your desk, but out and about and seeing what the staff is doing, what they're saying, how are they interacting with the patient. First-hand information can't be beat, and that's what we do with lean. We go to the Gemba. We gather the information from the staff, We bring the staff back out there during these rapid improvement events again so that they can see what their peers are doing, and they come back with solutions that are always generated by creativity before capital. So rarely, if ever, do we come forward with a solution that's going to cost money. We ask the staff to talk about changing the flow of their work in taking care of the patient by being creative and coming up with ideas. And when given the opportunity, they do that. But seeing the CEO, seeing the chief nursing officer, seeing the chief financial officer out and about and walking is a game changer. Going to see where the work is done is an imperative when you're working on this type of in this type of environment. And for all of healthcare, having a hospital like Nassau University Medical Center embrace this concept is wonderful. That really changes the way we position ourselves.
Because I know, I'm always, every day, I'll grab Craig Rizzo, who's one of the executive vice presidents. I'll, come on, Craig, let's go for a walk, and we'll just go to the different floors, and we'll walk and we'll talk to the nurses, and we'll walk and talk to the patients, and actually get a real feel for what's happening. And that's where you learn. As a CEO, I could sit upstairs on the 19th floor and worry about the budget, or I can be downstairs with the employees, asking them, how do I make this better? And you see things, you really do. And the employees are really enthusiastic when they see me about giving. I just got an email a few minutes ago about, I put a video up, take the stairs. So I'm trying to get everybody, instead of taking the elevators, because it's 19 floors, to take the stairs. So we made like a little silly video, and we interview Dr. Booten from the emergency department. He says, listen, I'm taking the stairs because it's healthy. And then we interview, some of the other doctors, cardiologists, Dr. Macarius. Oh yeah, it's good for your heart to take the steps. So someone just emailed me before, Dr. Pleedy, why don't you paint the stairs, bright colors, and put some things on the wall so people as they're taking the stairs can read, calories. You just, by walking up this flight of steps, you could have an extra M&M or something. It's just some sort of cheerleading things. And so, and he's right. And I don't know if it's he or she, because they only signed it, they didn't say with the name, but they said you should paint the stairs and real bright color and put some stuff on the walls, to do that. And some other people have mentioned that to me as well. So I think that's what we're going to do. We're going to go back and do that. So people are very involved in Nassau University Medical Center. And the little work that you suggest, and things like, one of the hallways was really just all white. And they painted it these different colors,
Yes.
Like a bluish color with a half, and the whole atmosphere of that whole unit just changed just based on that. So there's so many great things going on in that hospital, and there's so many areas that need, that we can improve and that we're going to improve, and it's just so exciting to be part of that hospital, and to know that I have you as a partner, and that I can go down there and we sit down in the lean lab, and you have a group of really hardworking, forward-thinking people. To come up with solutions, that's the secret to success here, I think, and to making the change that Nassau University Medical Center is undergoing right now. So, I mean, there's so many other things that we need to talk about. There's so many other areas, I think, that you're developing. So what's the next RIE?
The next RIE is talking about how we draw blood from the patients.
Really? That's interesting.
And it's interesting because right now we have a phlebotomy team that goes up in the morning and draws bloods that our docs have ordered. But on occasion, when they call in sick, the process for who's going to take that responsibility needs to be better organized and mapped out. It was always, we can't do it, so you need to do it. We need to put some structure around that.
So it would fall back on the nursing team, and the nurses would draw the bloods and would delay stuff.
Exactly.
So that's great. I mean, that's exactly what we need. So you look at something, and no one even thinks of something as small and, what you might think is innocuous as that. But you'll turn this into a whole rapid improvement event. You'll come up with some ideas, and we'll fix it, and then you're on to the next issue.
The next one.
Wow, what a great lecture. This lean is really an interesting process. So anyway, I want to thank everyone for listening.
Thank you.
Janeann Zink, thank you very much for being a guest today. A lean process sounds like a thesis for some guy taking his master's in healthcare administration.
Well, actually, for the first time ever, we have a fourth-year medical student doing his elective rotation with us, which is just fabulous.
Wow, elective and lean. And it does sound as a great process improvement program. So, this is Nassau University Medical Center. I'm Dr. Politi. Amazing things going on at that hospital. We really want you to take another look at it, and to realize that you have one of the finest hospitals in New York, right there on Hempstead Turnpike, in East Meadow. So, I want to wish everyone a really great day today. Stay healthy. We're here if you need us, and enjoy your day. Thank you.